Last week, Governor, you said that the University of Washington model was a little bit different than Rhode Island's model, and that you thought there would be more cases, more deaths. That number's now been updated. Is that number actually more? Are the latest numbers sort of more what you're looking towards?
Is that Dan McGowan?
Yes.
Hi. So, yes, in fact, we've been in touch with them and working with them throughout, I don't know, the past 4 or 5 days. Their previous model was based on a model that looked like Wuhan, China, and as a result, they assumed 100% compliance with the social distancing and even more aggressive social distancing than is, frankly, feasible in the United States. So in consultation with us, they have updated and changed their model, and I would say, yes, we think it's now more accurate.
Governor, this is Kate Nagel at Go Local. I had asked you at the press conference, the question was not read. Why had you told Rhode Islanders last week that you would have modeling available on Monday and did not disclose anything today?
Today I chose to focus on the CVS announcement since that was such a game changer, but I'm happy to answer your questions. I did talk about the modeling, Kate, at the presser. And as Anthony said, it's online.
Governor, this is
Mary McDonald. Governor, it's still Bartholomew. I was wondering if you could.
This is Mary McDonald from the PBN. Can you tell me how many ventilators we have and how many you expect to need at peak?
Yeah, sure. So you're asking how many ventilators we have right now. So we have about 388 right now. Right now, about 21% are in usage. And so we're trying to acquire more. I can't tell you exactly how many we're going to need. We're just trying to acquire more. It's the same approach every other state is taking, is no matter how much you have, you don't really have enough. So we are trying to acquire more. But right now, and keep in mind, a ventilator is only used by one person at a time right now is how we plan on using it. You might have been reading some things about people splitting ventilators. We're not planning on that right now. Our approach is to have one person a ventilator. That would be a last resort option. So we have 388. About 21% are currently in usage.
Hi, this is James.
How many healthcare workers in Rhode Island have contracted coronavirus? How many healthcare workers have contracted coronavirus in Rhode Island?
I know about a third of our cases are healthcare workers.
Hi, this is James Nanny, Law 360. I was wondering if you could tell me what the governor plans on doing about taxes this budget season. Is she still offering new taxes, or is she, in light of all the COVID-19 revenue shortfalls?
Am I still what? Taxes, if people can pay their taxes by April 15th, I would appreciate it if they would. We've extended the tax deadline until July 15th. I won't know for a couple of months exactly how much our revenue has dropped off, but I'm prepared for the fact that it's dropped off a cliff. Our third biggest source of revenue in Rhode Island is Twin River and the lottery, and that's closed. And our unemployment rate is higher than it's been in a long time. So now, on the flip side, we are receiving over $1 billion in stimulus money from the federal government at the end of April, and we'll be able to use that to offset COVID-related costs. Mm-hmm. So, it's tough. It's a very difficult budget picture, and after we get the stimulus and figure out how we can use it, we have some visibility into what our actual revenue is, we'll figure out how to balance our budget.
So you don't know if you're going to run for the disabled community right now? Are there any specific protocols being made for anyone who may be wheelchair bound or homebound when it comes to COVID-19 testing or just day-to-day life for anyone who's disabled right now?
Yeah, so this is Dr. McDonald. So we're trying to stand up some home-based testing. That's something that we don't have available yet the way we would like to. That's something that we're going to work on. As long as the governor announced yesterday the transportation model that's out there, So we know that's an area that's a vulnerability, but we're working on that. Right now, what's happening if people are disabled and they can't get to a test site, EMS is bringing them, which isn't an ideal solution. So it's something we're working on. And if we can get home-based testing to work, that would be helpful. There are some companies who have offered to do it. The problem they're running into is they don't have the personal protective equipment. And it just kind of gets to the complexity of this pandemic. You know, it would be hard enough to manage the pandemic, but not having the PPE in the abundance like we did for H1N1, you know, it's a rate-limiting step, and that's part of what limits our response.
What about to release the technical details of the model?
How many of the healthcare workers are fatalities? Of the 1/3 of cases are healthcare workers, how many healthcare worker fatalities have there been?
All right, so there haven't been any fatalities among healthcare workers. And keep in mind, in the beginning, we found healthcare workers because we found what we were looking for. That number will drop dramatically because now as more people are able to be tested. That's one of the biases of case finding. In other words, keep in mind that for the beginning, we were testing admitted patients to a hospital, healthcare workers, and those in congregate settings. So it wasn't at all surprising that 1/3 of our cases were healthcare workers. So, you know, if you ask me this question in 2 days, it'll probably drop in half. But just to make sure you have a clear answer that there's been no fatalities among a healthcare worker. Most of our fatalities have been among folks who have been elderly and have had underlying conditions. And that's very sad. And, you know, there's 27 of us who aren't with us anymore.
What's the youngest fatality?
Is there any opportunity to release the technical details of the model? Because if we could see the technical details of the model, we could actually make that available to the public in a comprehensible way so that they could actually, say, vary the inputs and see what social distancing does according to the model. This is Michael Billa from Motif.
So you can go online right now and look at the IHME model.
Dr. McDonald, this is Steph Machado.
Clarity around masks and essential businesses. I believe you said today at the press conference that businesses, employees should have masks. I don't believe that's what they have been doing. What should be the practice right now at essential businesses?
Right. So if you're a critical infrastructure worker, oh my dear, right. I hope the static didn't hurt anybody there. But keep in mind, if you're a critical infrastructure worker, like you work in a grocery store, a gas station, a bank, you should be wearing some kind of face covering, something that covers your nose and your mouth. And my guess that people aren't doing them right now is probably they just didn't feel like they were told to. It's interesting. I came in the Department of Health this morning wearing my mask, and almost everybody at the Department of Health was wearing a surgical mask. And that wasn't the case Sunday and Saturday. So it's just clear to me that people are looking for that new, what's the norm, what I'm supposed to do. Like, and we think about the now normal where we are right now. The now normal is we wear some type of facial covering our nose and our mouth if we're out and about. And if we're a critical infrastructure worker, it's really a requirement.
Dr. McDonald,
do you have an update on the case numbers at the nursing homes holding press?
I think I hear Steph Machado.
Hi, thank you. Dr. McDonald, yesterday you mentioned that there might be some cohorting of nursing homes or specialty nursing homes to address that crisis. Can you be more specific about what's happening there and which nursing homes might handle this particular situation?
Yeah, so the strategy is going to be to cohort patients with COVID in a few nursing homes. And we aren't announcing the names of the nursing home yet because those agreements are being finalized as we speak. I've been on conference calls about those on Saturday, Sunday, and so far this morning. So that's moving along. But the notion is creating COVID-19 specialty nursing homes, it offers some economies of scale. One is we can have more PPE at those places. The doctors and nurses who will be taking care of the patients will have more familiarity with the folks who have COVID-19. And ideally, the folks would have better outcomes. And then what the hospitals need, because one of the things we have to keep in mind is the pandemic is like a little Rubik's Cube. You can't have the hospitals with patients who are ready to go to home or nursing home and can't go anywhere. So we need to have a place for a patient in the hospital to go. And quite frankly, we don't want to send a patient who's COVID positive into a COVID negative nursing home because that just brings a little risk to that nursing home. That's why the cohorting is underway. And that's a strategy some other states have done. So that's where we're headed. But I can't tell you the answer to your question exactly today, but I hope to have the answer tomorrow or the next day.
Thanks.
Do you have any update on the case numbers at Golden Crest and Oak Hill? Has the outbreak increased, or are you having problems at any other nursing homes?
So right now, there's 17 nursing homes in the state with at least one case. At Golden Crest right now, they have roughly 70 cases, which accounts for some of the residents and the staff. Oak Hill has roughly 70 cases as well. Those are the two big nursing homes with the most cases. Now, we do have nursing home cases in significant quantities at Riverview, Orchard View Manor, Mount Serena, and Oakland Grove.
Doctor, this is Dan.
What do you need most from the federal government in the next few days, and are you getting what you need?
So they sent us 15 new high-speed Abbott diagnostic machines, but each machine was supposed to have come with 150 test kits, and they only sent 120 test kits in total. So I need to get the rest of the test kits. We are trying to get our ventilator orders fulfilled. We are still trying to get the PPE that we need from the federal government. It's a long list. It's a daily discussion, trying to get them to advance the money to our hospitals. Hospitals are really struggling, and this is a day-to-day thing. So it's no one thing.
Are those
Doctor, can you give us a
ones that are being used at CVS, or are those different?
Say that again, please.
Are those 15 Abbott machines that you're getting from the federal government, are those the same ones being used at the CVS Health facility at Twin River, or are they different in addition?
They're different.
Governor, if you can open all of the private, whether it's ortho, RI, or any remote surgical centers to use for non-COVID patients as a secondary hospital or anything like that, essentially engaging the private sector?
So if I understand the question correctly, are our alternate care sites going to be, this is Dr. McDonald, by the way, the alternate care sites, my understanding is we're going to be using those for low acuity COVID positive patients. So in other words, people who are just starting with the illness or recovering. That's the current approach that's planned for Rhode Island. Right now, there's not anybody at any one of these sites. So as we work with the hospitals who are managing the alternate care sites, that's the strategy they have preferred to go with. And what we're doing is working with the hospitals to do it in a way that makes the most sense for them and keep the patients safe.
Governor, Dr. McDonald, I am hearing from the nursing home
or anything like that. Is that on the table to use remote surgical centers for non-COVID patients?
Oh, I'm sorry. So if the question was, are we planning on using ambulatory surgical centers for non-COVID patients? So
yes.
So that's an interesting question. One of the things we run into with that, though, is we still don't have enough PPE. So if we need that surge capacity, that can happen. The problem you run into, though, is you have to cohort patients where the personal protective equipment is. So that's not an idea that's a bad idea at all. It's been considered. But we have to be careful how we do these things, because if you put this gets to the whole elective surgery issue. If you have people having elective surgery, we're using personal protective equipment. And then you have people who are recovering. And keep in mind, even if you're doing it as an ambulatory surgical procedure, a small percentage of those spend the night in the hospital because then things go as well as we hope they would. So we have to be careful of that. Now, using those facilities for surge capacity, which is kind of what I think you're asking, is a possibility, and that is part of people's discussion. So, yeah.
We have about 2 minutes left with the governor.
Dr. McDonald,
can you give us a ballpark figure on how many people are currently in the contact tracing database? And also just describe who's going into that database. For instance, if you're getting tested negative, do you also go into that database?
So just to make sure I understood your question correctly, I think what you wanted to know is how many people were in our contact tracing database. So right now, there's about 1,800 people on quarantine. And I don't know how many contacts are in there. It would be much more. So I don't have a specific number for you, but let me work on that just so we can get an idea about that, because we do have to keep track of people.
I have a question. Governor or Dr. McDonald, and In Massachusetts, this is Nancy from Rhode Island News Today. In Massachusetts, they've ramped up the DLT staff from 50 to 300 and again to 550. What are we doing in Rhode Island to ramp up our staffing so that calls can be taken from the call center and claims process?
Was the question about call center staffing at DLT or DOH? I'm sorry.
DLT. They went from 50 to 300 to 550 in Massachusetts. Are we hiring more people?
So it's Brett Smiley from the Department of Administration. The staff at DLT is all fully engaged and working split shifts. We are also we have reassigned some other state workers who are in similar job classifications that can help with the call center volumes, and so we are ramping up that staffing, although they're not new hires, they're reassignments. And then finally, we are exploring some additional options for augmentation to help process those claims, but we've not yet executed any new contracts or any new hires. So the augmentation right now is coming from the reassignment of other state employees.
Governor and Dr. McDonald,
how quickly
about the nursing home industry. I was reached by a member of the nursing home industry who suggested they were concerned about the new initiative for the MTM assistance for Medicaid patients to be given rides to COVID testing. If we have potential COVID testing positive patients and the contamination issues that may arise from the vehicles themselves that transport nursing home patients to their regular visits, nursing home agencies are very concerned about that kind of contamination. You want to respond to that?
Yeah, so when people are transported, the driver needs to have personal protective equipment, and that's one of the things that's important, like a surgical mask. Important. And then as far as, the vehicle itself, it should be cleaned after the patient's usage. And that's just a sensible thing to do, to just use normal cleaners just to mitigate the risk for the next person coming on board.